Okay, now let's proceed to Module 5, Part 2 discussion about the parts and functions of the GIT, beginning with your mouth. Your mouth is also known as your oral or buccal cavity. Buccal because it's actually covered by a muscle known as your buccinator muscle, responsible for the action of blowing and sucking. Then you have your orbicularis oris, which is a muscle responsible for the action of kissing or just keeping your mouth closed. So the mouth or oral cavity is laterally formed or covered by your cheek. Anteriorly sa babaw is your hard palate, and posteriorly sa babaw is your soft palate and uvula, and the floor is your tongue. Your mouth also contains salivary glands, which of course produce what you call as your saliva. And your saliva actually contains secretions known as your serous secretion, which is comprised of salivary amylase or thiolin, which is a type of enzyme capable of breaking down carbohydrates. And then you have your mucus secretion composed of mucin, responsible for making your food that you have chewed into a bolus. Right? So for the salivary glands, you have your parotid, submandibular, and sublingual, the largest of which is your parotid gland. Next, you have your saliva. The normal amount that your body makes is 1,000 to 1,500 ml per day, and the pH is 6.35 to 6.85, so that's slightly alkalinic. So the composition of your saliva include 99.5% water and 0.5% solutes. So mas damo ka water than solutes. The purpose of the water there is, of course, to dilute the food that you have broken down. And then for the other substances, you have your chloride ions, which is important for activating your salivary amylase here, which is an enzyme. Then you have your bicarbonate and phosphate ions, responsible for buffering your saliva and making it less acidic. Then you have your urea and uric acid, which are waste products, which is why sometimes your salivary glands get called sweat glands of your mouth. Then you have your mucus, of course, containing mucin for binding into a bolus. And then you have your IgA and lysozyme, which contain antimicrobial or antibacterial properties. But again, this is not enough to get rid of all the bacteria inside your mouth, ang IgA and lysozyme alone. So for the process of salivation, it's controlled by your ANS, mainly your parasympathetic system. So with the activation of your parasympathetic response, you have increased saliva, and with your sympathetic, it's a decrease in saliva production. The salivation reflex, there are two types. You have your simple and acquired. For simple, the only stimuli or stimulus you need is food inside your mouth already. And that's what triggers the salivation. However, for acquired reflexes, lots of other stimuli can trigger salivation, including the sight of food, the smell of food, right? Even just the thought of food can make you salivate. So that is an acquired salivation reflex. Next, you have your tongue. So it forms the floor of your oral cavity. It is covered in papilla. Excuse me. So this is your papilla. These are structures that contain taste buds, contain touch receptors, and increase the friction in your tongue, which can help with the process of turning the food into a bolus. Sorry, turning the food into a bolus. What else? Your tongue contains von Ebner's gland secreting lingual lipase, which is another type of enzyme. So amo ni si tongue, it is skeletal muscle all over, covered with mucous membrane. For the innervation of the tongue, especially for sensory innervation, you have your cranial nerve number 7, or your facial nerve, which is responsible for the taste of the anterior 2/3 of the tongue. You have your CN9 for the taste and sensation of the posterior 1/3 of the tongue, and CN5 for the sensation of the anterior 2/3 of the tongue. Sensation niya is different from taste. Taste is sweet, salty, bitter, sour, umami. And then sensation naman niya is touch, pressure, pain, right? And also the sense of spiciness. Okay, so amo na siya ang for sensation. Different, again, taste and sensation, and different cranial nerves as well. For the motor innervation of the tongue, it's CN12, your hypoglossal nerve, and it controls intrinsic and extrinsic muscles of the tongue. Intrinsic muscles for altering shape, usually for swallowing and for speech, and for extrinsic gross movement, which helps with the process of swallowing. Then you have your teeth, also known as dentes. So they form a type of fibrous joint with your mandible, also known as your gum fosses. So important parts I wanted to remember: crown, neck, and root. Crown is what is visible, neck is what connects crown and root is what contains nerve and blood supply. Also, you have your enamel, which is a hard substance covering the dentin, which is what gives your tooth its shape. Then you have your gingiva or your gum, your pulp, and your root canal both contain nerve and blood supply. And if you take a look at this picture here at the bottom, this is what it looks like when enamel is eroded. This is the enamel, ang white, and then the yellow white is your dentin. So, but also I wanted to remember are the important functions of the teeth. So the back teeth, molars, and premolars, usually for crushing and grinding the food. Your canines are for tearing the food, and your incisors up front are for cutting of the food. And the process of chewing is also known as mastication. And the muscles involved are your temporalis, lateral and medial pterygoid, and masseter. And all of them are innervated by your cranial nerve 5, also known as your trigeminal nerve. So they open and close your temporomandibular joint, or your TMJ joint, found here, or also known as your jaw joint. For the dentitions or set of teeth, you have your deciduous, primary, baby, or milk teeth, and a total of 20 teeth are found there. The first of which to erupt are your lower central incisors. So this one will be the first to come up at 6 to 8 months old. Then you have your permanent or secondary teeth comprised of 32 teeth. And then you have your first molars, second molars, and your third molars are also known as your wisdom teeth. Next, you have your pharynx, aka your throat. So it has 3 parts: naso, oro, and laryngopharynx. Si nasopharynx, exclusive lang siya for respiration functions. So only air can pass through your nasopharynx. However, both the oro and laryngopharynx contain or have air, and then food passed through them. So they have functions with regards to the respiratory system as well as your digestive system. So si nasopharynx lang ang exclusive kay respiratory. Next, you have your esophagus. This is a long collapsible tube capable of peristalsis but not capable of secretions, not capable of digestion, and not capable of absorption. So alagyan lang yun si esophagus, right? And as you can see here, its location is that it pierces your diaphragm. So galustot siya, gasulod siya kay diaphragm, ga-pierce through. And this is the part known as your esophageal hiatus. Okay? What else? Your esophagus contains sphincters, your upper and lower esophageal sphincter. So the upper is the passageway from the pharynx towards your esophagus, and the lower is from your esophagus to your stomach. So very important sa lang sphincters because they make sure, sa lower gid especially, that the acid inside the stomach does not go up kay esophagus. Then you have here the process of deglutition. This is also known as the process of swallowing, and there are 3 phases. Your voluntary, which is from your mouth to your oropharynx. Your pharyngeal stage is involuntary, which is from your oropharynx to your laryngopharynx towards your esophagus. And then your esophageal stage is also involuntary from the esophagus towards your stomach. And ang ga-control na sa ila is your medulla oblongata and your lower pons. So those are your deglutition centers. So this is how swallowing works. Your tongue moves the bolus against your palate, the roof of your mouth, and then i-roll yan na siya backwards. So once the bolus is now in your oropharynx, it activates receptors and stimulates your deglutition center, which is what we mentioned a while ago. Then, your soft palate and uvula move upwards to close your nasopharynx para hindi magsaka ang food. Then, your epiglottis closes off your larynx so that the food doesn't, hindi siya magtalang and mag-go kay respiratory tract. Then, the upper esophageal sphincter relaxes, allowing the food to now go down your esophagus. Then, peristalsis happens. Bolus is propelled downwards until it reaches your lower esophageal sphincter, where it begins to relax under what you call a receptive relaxation. So meaning, sa receptive relaxation, gapaabot na siya nga may manaog nga bolus, so ga-relax siya. So it senses that there is bolus in the esophagus, allowing it to relax in anticipation of that bolus itself. So that is it for the part 2. For part 3, we'll begin with stomach. Thank you for listening.